Question 1. A medical assistant is preparing to administer an intramuscular injection to an adult patient. Which of the following needle gauges is most appropriate for this procedure? A. 18 gauge. B. 21 gauge. C. 25 gauge. D. 27 gauge. Answer: B. 21 gauge. This question tests your knowledge of appropriate needle selection for intramuscular injections, a common CCMA task. The keyword intramuscular injection indicates the needle needs to be long enough to reach the muscle and wide enough to allow the medication to flow, but not overly large to minimize patient discomfort. A 21 gauge needle is typically used for intramuscular injections because it strikes a good balance between patient comfort and medication viscosity, while larger gauges like 18 are usually for blood collection or very viscous medications, and smaller gauges like 25 or 27 are for subcutaneous or intradermal injections. For example, when giving a flu shot into the deltoid muscle, a 21 gauge needle would be a standard choice. Remember, smaller gauge numbers mean larger needle diameters. Question 2. Which of the following components is included in a patient's demographic information? A. Medical history. B. Insurance policy number. C. Chief complaint. D. Vital signs. Answer: B. Insurance policy number. This question focuses on understanding what constitutes demographic information, a crucial part of patient registration and record-keeping for a medical assistant. The term demographic information refers to identifying data about the patient and their contact/billing details, rather than their health status. An insurance policy number is a key piece of demographic information, as it's used for billing and identification, whereas medical history, chief complaint, and vital signs are clinical data. For instance, when a patient first arrives at the clinic, collecting their insurance information is part of gathering their demographics. Always ensure patient demographics are accurate to prevent billing errors and ensure correct patient identification. Question 3. A medical assistant is performing an electrocardiogram, ECG, on a patient. Which lead is created by the right arm and left arm electrodes? A. Lead I. B. Lead 2. C. Lead 3. D. Lead AVF. Answer: A. Lead I. This question tests your foundational understanding of ECG lead placement and the electrical pathways they represent. The keyword right arm and left arm electrodes directly points to one of the limb leads. Lead I specifically records the electrical activity between the right arm and the left arm, measuring the potential difference between these 2 points. Leads 2 and 3 involve the left leg electrode, while AVF is an augmented vector lead. For example, if you visualize the electrodes on the patient's body, lead I connects the top 2 arms horizontally. Remember, understanding these basic connections is essential for accurate ECG placement and interpretation. Question 4. What is the primary purpose of a Material Safety Data Sheet, MSDS? A. To list all medications a patient is taking. B. To provide information about hazardous chemicals. C. To document a patient's allergies. D. To record the results of laboratory tests. Answer: B. To provide information about hazardous chemicals. This question assesses your knowledge of workplace safety regulations and documentation, specifically regarding hazardous materials. The acronym MSDS, now often called Safety Data Sheet or SDS, is the key clue, as its function is explicitly to provide detailed information about potentially dangerous substances found in the workplace. An MSDS details chemical properties, health hazards, protective measures, and safety precautions, which is critical for medical assistants handling various cleaning solutions or chemicals. For example, if a cleaning product spills, the MSDS would tell you how to safely clean it up and what personal protective equipment, PPE, to use. Always consult the MSDS before handling any unfamiliar chemicals to ensure your safety and the safety of others. Question 5. A medical assistant is reinforcing teaching with a patient about proper body mechanics. Which of the following instructions should the assistant include? A. Twist at the waist when lifting heavy objects. B. Lift objects by bending at the waist with straight legs. C. Stand with a wide base of support and bend at the knees. D. Hold heavy objects away from the body to maintain balance. Answer: C. Stand with a wide base of support and bend at the knees. This question evaluates your understanding of proper body mechanics, which is vital for preventing injuries in a healthcare setting. The instruction to stand with a wide base of support and bend at the knees describes the correct technique for lifting or moving objects, including patients, by engaging the stronger leg muscles rather than straining the back. Twisting at the waist or bending with straight legs can lead to back injuries, and holding objects away from the body increases leverage and strain. For instance, when helping a patient transfer from a wheelchair, you should widen your stance and bend your knees, keeping your back straight. Always prioritize your safety and the patient's safety by using correct body mechanics. Question 6. Which of the following routes of administration is typically used for a tuberculin skin test, PPD? A. Intramuscular. B. Subcutaneous. C. Intradermal. D. Intravenous. Answer: C. Intradermal. This question tests your knowledge of medication administration routes, specifically for a common diagnostic test. The tuberculin skin test, PPD, is a key clue, as this particular test requires a very specific injection technique. An intradermal injection involves administering medication into the superficial layer of the skin, just below the epidermis, creating a small bleb or wheal, which is crucial for the proper absorption and reaction of the PPD test. Intramuscular and subcutaneous injections go deeper, while intravenous is into a vein. For example, when administering a PPD, the needle is inserted at a 10 to 15 degree angle. Accurately administering intradermal injections ensures the test results are reliable. Question 7. A patient has a fever of 102.4 degrees Fahrenheit. What term is used to describe this condition? A. Hypotension. B. Bradycardia. C. Pyrexia. D. Hypoglycemia. Answer: C. Pyrexia. This question assesses your medical terminology knowledge related to vital signs, a fundamental concept for a medical assistant. The keyword fever of 102.4 degrees Fahrenheit indicates an elevated body temperature. Pyrexia is the medical term for fever or an elevated body temperature, typically above 100.4 degrees Fahrenheit 38 degrees Celsius. Hypotension is low blood pressure, bradycardia is a slow heart rate, and hypoglycemia is low blood sugar. For example, when documenting a patient's elevated temperature in their chart, you might note patient presents with pyrexia. Familiarizing yourself with common medical terms will help you understand and accurately document patient conditions. Question 8. Before administering medication, a medical assistant must verify the 6 rights of medication administration. Which of the following is one of these rights? A. Right time. B. Right room. C. Right cost. D. Right mood. Answer: A. Right time. This question evaluates your understanding of the critical 6 rights of medication administration, which are essential safety checks for every medical assistant. The 6 rights are a standard safety protocol designed to prevent medication errors, and right time is one of them, ensuring the medication is given according to the prescribed schedule. The other rights include right patient, right medication, right dose, right route, and right documentation. For example, if a medication is prescribed twice daily, administering it at the correct intervals is part of ensuring the right time. Always double-check all 6 rights before giving any medication to a patient to ensure their safety. Question 9. What is the primary purpose of obtaining a patient's chief complaint? A. To gather demographic information. B. To determine the patient's insurance coverage. C. To identify the reason for the patient's visit. D. To record the patient's complete medical history. Answer: C. To identify the reason for the patient's visit. This question focuses on the initial steps of patient assessment and the importance of gathering relevant information. The keyword chief complaint refers to the main reason why the patient is seeking medical attention, stated in their own words. Obtaining the chief complaint helps the medical assistant and the provider understand the primary concern that brought the patient to the clinic, guiding the subsequent assessment and treatment. While demographic information, insurance details, and a full medical history are important, the chief complaint specifically addresses the immediate reason for the visit. For example, a patient might state, "I have had a sore throat for 3 days," which would be their chief complaint. Always document the chief complaint accurately and concisely. Question 10. A medical assistant is preparing a sterile field. Which of the following actions should the assistant take? A. Place sterile items within 1 inch of the edge of the sterile field. B. Turn your back to the sterile field to retrieve additional supplies. C. Place non-sterile items on the sterile field first. D. Hold sterile items above the waist. Answer: D. Hold sterile items above the waist. This question tests your knowledge of maintaining a sterile field, a critical aspect of infection control in clinical procedures. The instruction to hold sterile items above the waist is a fundamental principle because anything below waist level is considered non-sterile due to potential contamination from clothing or other surfaces. The 1-inch border rule states that the outer inch of a sterile field is considered non-sterile, and turning your back or placing non-sterile items on the field would breach sterility. For example, when transferring a sterile instrument, keep it within your line of sight and above your waist. Always remember that a sterile field must be kept completely free of microorganisms to prevent infection. Question 11. Which of the following positions is most appropriate for a patient experiencing shortness of breath? A. Supine position. B. Trendelenburg position. C. Fowler's position. D. Lithotomy position. Answer: C. Fowler's position. This question assesses your knowledge of patient positioning, particularly for common respiratory distress symptoms. The phrase shortness of breath is the key indicator for choosing a position that facilitates easier breathing. Fowler's position, where the patient is sitting upright with the head of the bed elevated, typically 45 to 60 degrees for semi-Fowlers or 90 degrees for high Fowlers, helps to reduce pressure on the diaphragm and allows for maximum lung expansion. Supine is lying flat on the back, Trendelenburg involves the head lower than the feet, and lithotomy is for gynecological exams. For instance, if a patient comes in wheezing, helping them into a comfortable Fowler's position can provide immediate relief. Proper positioning can significantly improve a patient's comfort and breathing. Question 12. A medical assistant needs to collect a urine specimen for a culture and sensitivity test. Which type of specimen is most appropriate? A. Random urine specimen. B. First morning urine specimen. C. 24-hour urine specimen. D. Clean catch midstream urine specimen. Answer: D. Clean catch midstream urine specimen. This question tests your understanding of different urine specimen collection methods and their specific uses. The phrase culture and sensitivity test is the critical clue, as this type of test requires a specimen that is as free from contamination as possible. A clean catch midstream urine specimen is collected after the patient cleanses the perineal area and voids a small amount of urine into the toilet before collecting the main portion, thereby minimizing bacterial contamination from the urethra or skin. Other types of specimens are used for different purposes, like random for routine analysis or 24-hour for quantitative analysis. For example, when a patient suspects a urinary tract infection, they would be instructed to provide a clean catch midstream sample. Always provide clear instructions to patients for proper specimen collection to ensure accurate test results. Question 13. Which of the following is the most effective method to prevent the spread of infection? A. Wearing gloves. B. Wearing a mask. C. Hand hygiene. D. Disinfecting surfaces. Answer: C. Hand hygiene. This question evaluates your fundamental knowledge of infection control, emphasizing the most impactful preventive measure. The keyword most effective method highlights the need to identify the single best practice. Hand hygiene, which includes hand washing with soap and water or using alcohol-based hand rub, is universally recognized as the single most effective way to break the chain of infection and prevent the spread of microorganisms in healthcare settings. While gloves, masks, and surface disinfection are important, they are part of a broader infection control strategy, and their effectiveness is diminished without proper hand hygiene. For example, after removing gloves, a medical assistant must always perform hand hygiene. Always prioritize proper hand hygiene before and after every patient encounter and after touching any contaminated surfaces. Question 14. A medical assistant is documenting a patient's vital signs. Which of the following abbreviations indicates as needed? A. BID. B. PRN. C. TID. D. NPO. Answer: B. PRN. This question assesses your familiarity with common medical abbreviations, which are frequently used in documentation and medication orders. The abbreviation PRN stands for pro re nata, which is Latin for as needed. This is crucial for understanding when to administer certain medications or perform specific interventions. BID means twice a day, TID means 3 times a day, and NPO means nothing by mouth. For example, if a patient has an order for pain medication PRN, it means they can receive it when they experience pain, not on a fixed schedule. Knowing common medical abbreviations helps ensure clear and accurate communication in the healthcare setting. Question 15. What is the normal range for an adult's respiratory rate? A. 8 to 12 breaths per minute. B. 12 to 20 breaths per minute. C. 20 to 24 breaths per minute. D. 24 to 30 breaths per minute. Answer: B. 12 to 20 breaths per minute. This question tests your knowledge of normal vital sign ranges, a core competency for medical assistants. The keyword normal range for an adult's respiratory rate requires you to recall the standard parameters for healthy breathing. A normal adult respiratory rate typically falls between 12 and 20 breaths per minute, indicating healthy lung function and oxygen exchange. Rates below 12 or above May 20th indicate an underlying medical condition. For example, when taking vital signs, observing a patient breathing at 16 breaths per minute would be within the expected normal range. Always pay close attention to vital signs as they provide crucial insights into a patient's overall health status. Question 16. A medical assistant is preparing to perform venipuncture. In which direction should the bevel of the needle be oriented? A. Upward. B. Downward. C. Sideways. D. It does not matter. Answer: A. Upward. This question assesses a critical technical detail for safe and effective venipuncture, a common clinical skill. The bevel of the needle refers to the slanted opening at the tip. For venipuncture, the bevel should always be oriented upward, facing the ceiling, when entering the vein. This orientation allows for a smoother entry into the vein, minimizing tissue trauma and reducing the risk of the needle going through both walls of the vein. If the bevel is down, it can scrape against the vessel wall or make entry more difficult. For example, before inserting the needle into the patient's arm, ensure you can see the bevel facing up. Proper needle orientation is essential for successful and comfortable blood draws. Question 17. Which of the following medical terms refers to low blood sugar? A. Hyperglycemia. B. Hypoglycemia. C. Hypertension. D. Hypotension. Answer: B. Hypoglycemia. This question evaluates your understanding of fundamental medical terminology, specifically related to blood glucose levels. The term low blood sugar is the direct clue. Hypoglycemia literally means below normal, hypo, sugar, glyc, in the blood, emia, describing a condition where blood glucose levels are too low. Hyperglycemia is high blood sugar, hypertension is high blood pressure, and hypotension is low blood pressure. For instance, a diabetic patient might experience hypoglycemia if they take too much insulin or don't eat enough. Understanding these terms is vital for communicating patient conditions accurately and efficiently. Question 18. A medical assistant is preparing a patient for a gynecological examination. Which position should the assistant place the patient in? A. Prone position. B. Supine position. C. Lithotomy position. D. Lateral recumbent position. Answer: C. Lithotomy position. This question tests your knowledge of appropriate patient positioning for specific medical examinations. The phrase gynecological examination is the key indicator for the correct position. The lithotomy position involves the patient lying on their back with their legs separated, flexed at the hips and knees, and often supported in stirrups. This position provides optimal access and visualization for pelvic and gynecological examinations. Prone is lying on the stomach, supine is lying flat on the back, and lateral recumbent is lying on the side. For example, when a patient arrives for a pap smear, you would assist them into the lithotomy position. Knowing the correct positioning ensures patient comfort and facilitates the examination. Question 19. What is the purpose of obtaining a pulse oximetry reading? A. To measure blood pressure. B. To assess the oxygen saturation in the blood. C. To determine body temperature. D. To evaluate heart rhythm. Answer: B. To assess the oxygen saturation in the blood. This question evaluates your understanding of a common vital sign measurement and its clinical significance. The term pulse oximetry refers to the non-invasive measurement of the oxygen saturation level in the patient's arterial blood. This reading indicates how well oxygen is being delivered to the body's tissues, which is crucial for assessing respiratory and circulatory function. It does not measure blood pressure, body temperature, or specifically heart rhythm, though it does show pulse rate. For example, a medical assistant would use a pulse oximeter on a patient complaining of shortness of breath to check their oxygen levels. Understanding what vital signs measure is essential for comprehensive patient assessment. Question 20. Which of the following is an example of an open-ended question? A. Are you feeling better today? B. Did you take your medication? C. Can you describe your pain? D. Is your headache severe? Answer: C. Can you describe your pain? This question assesses your knowledge of effective communication techniques, specifically the use of open-ended questions, which are vital for patient interviews. An open-ended question encourages the patient to provide a detailed, descriptive response rather than a simple yes or no. Asking, "Can you describe your pain?" prompts the patient to elaborate on their symptoms, location, and characteristics of their discomfort, providing more comprehensive information. The other options are closed-ended questions that elicit brief answers. For example, instead of asking, "Do you have pain?" asking, "Where is your pain and what does it feel like?" gathers much more useful diagnostic information. Using open-ended questions helps build rapport and gather a complete picture of the patient's condition. Question 21. A medical assistant needs to dispose of contaminated needles. Which of the following should be used for disposal? A. Regular trash can. B. Biohazard bag. C. Sharps container. D. Linen hamper. Answer: C. Sharps container. This question tests your understanding of proper biohazard waste disposal, a critical aspect of infection control and safety. The keyword contaminated needles immediately indicates the need for a specific, puncture-resistant disposal method. Sharps containers are specially designed, rigid, puncture-resistant, and leak-proof containers specifically for the safe disposal of needles, scalpels, and other sharp medical instruments, preventing injuries and the spread of bloodborne pathogens. Regular trash, biohazard bags, and linen hampers are not appropriate for sharps. For example, after administering an injection, the medical assistant should immediately place the used needle into a sharps container without recapping it. Always prioritize safety by correctly disposing of sharps immediately after use. Question 22. What is the term for a fast heart rate, above 100 beats per minute? A. Bradycardia. B. Tachycardia. C. Arrhythmia. D. Hypertension. Answer: B. Tachycardia. This question evaluates your medical terminology related to cardiac vital signs. The phrase fast heart rate, above 100 beats per minute, is the key indicator for this specific condition. Tachycardia is the medical term for an abnormally rapid heart rate, typically defined as over 100 beats per minute in adults. Bradycardia is a slow heart rate, below 60 bpm, arrhythmia is an irregular heart rhythm, and hypertension is high blood pressure. For example, if a patient's pulse is 115 bpm, you would document it as tachycardia. Understanding these terms is crucial for accurate communication and documentation in patient care. Question 23. A medical assistant is performing a capillary puncture for a blood glucose test. Which finger is the most common site for this procedure on an adult? A. Index finger. B. Thumb. C. Ring or middle finger. D. Pinky finger. Answer: C. Ring or middle finger. This question tests your practical knowledge of capillary puncture sites, a common procedure for point-of-care testing. The ring or middle finger, specifically, the lateral side of the fingertip, is the most common and recommended site for capillary punctures on adults. These fingers are generally less sensitive and provide adequate blood flow, while the index finger can be more sensitive, the thumb has a pulse, and the pinky has thinner tissue. For example, when performing a finger stick for a blood glucose check, you would gently prick the side of the patient's middle finger. Always ensure the site is warm and clean to get a good blood sample. Question 24. Which of the following terms describes the complete destruction of all microorganisms, including spores? A. Disinfection. B. Sanitization. C. Sterilization. D. Asepsis. Answer: C. Sterilization. This question assesses your understanding of different levels of infection control, focusing on the most comprehensive method. The phrase complete destruction of all microorganisms, including spores, is the key definition. Sterilization is the process that eliminates or kills all forms of microbial life, including highly resistant bacterial spores, making an object completely free of viable microorganisms. Disinfection reduces the number of pathogens, sanitization cleans objects, and asepsis refers to practices that reduce contamination. For example, surgical instruments must be sterilized before use in an operating room to prevent infection. Always ensure instruments that will penetrate body tissues are properly sterilized. Question 25. A patient calls the clinic stating they have a severe allergic reaction after taking a new medication. Which of the following actions should the medical assistant take first? A. Advise the patient to take another dose of the medication. B. Schedule a follow-up appointment for next week. C. Instruct the patient to call emergency services, 911. D. Tell the patient to wait and see if symptoms improve. Answer: C. Instruct the patient to call emergency services, 911. This question tests your ability to prioritize urgent situations and provide appropriate guidance during a medical emergency. The phrase severe allergic reaction is a critical clue, indicating a potentially life-threatening condition that requires immediate medical intervention. In such a scenario, the medical assistant's first action should be to instruct the patient to call emergency services, 911, or go to the nearest emergency department, as this reaction could rapidly worsen. Advising them to take more medication, wait, or schedule a non-urgent appointment would be dangerous. For example, symptoms like difficulty breathing, swelling, or hives all over the body warrant immediate emergency care. Always recognize and respond promptly to signs of severe allergic reactions to ensure patient safety. Question 26. Which plane divides the body into anterior, front, and posterior, back, portions? A. Sagittal plane. B. Transverse plane. C. Frontal, coronal, plane. D. Oblique plane. Answer: C. Frontal, coronal, plane. This question assesses your foundational knowledge of anatomical planes, which are essential for describing body regions and locations. The term divides the body into anterior, front, and posterior, back, portions directly defines the frontal, also known as coronal, plane. The sagittal plane divides the body into left and right, and the transverse plane divides it into superior, upper, and inferior, lower, portions. For example, imagining a line cutting your body from side to side, separating your front half from your back half, illustrates the frontal plane. Understanding anatomical planes is crucial for accurate communication in healthcare. Question 27. When measuring a patient's blood pressure, the first sound heard through the stethoscope is recorded as which pressure? A. Diastolic pressure. B. Systolic pressure. C. Pulse pressure. D. Mean arterial pressure. Answer: B. Systolic pressure. This question tests your practical knowledge of taking blood pressure, a fundamental vital sign measurement. The first sound heard through the stethoscope when deflating the blood pressure cuff corresponds to the systolic pressure. This is the maximum pressure exerted on the arteries when the heart contracts. The sound disappears when the diastolic pressure, the pressure in the arteries when the heart is at rest between beats, is reached. For example, if a patient's blood pressure is 120/80 mmHg, the 120 is the systolic pressure, representing the first sound. Accurately identifying these sounds is critical for precise blood pressure readings. Question 28. Which of the following legal doctrines states that an employer is responsible for the actions of their employees performed within the scope of employment? A. Residential ipsa loquitur. B. Respondeat superior. C. Stare decisis. D. Contra proferentum. Answer: B. Respondeat superior. This question evaluates your understanding of key legal principles relevant to healthcare, particularly employer liability. The doctrine of respondeat superior, Latin for let the master answer, legally holds an employer responsible for the negligent acts or omissions of their employees when those actions occur within the course and scope of their employment. This means the medical practice can be held accountable for the actions of a medical assistant. Residential ipsa loquitur means the thing speaks for itself, and stare decisis refers to judicial precedent. For example, if a medical assistant makes a medication error while on duty, the physician or clinic could also be held liable under this doctrine. Always understand that your actions reflect on your employer and contribute to overall clinic liability. Question 29. A medical assistant is preparing to perform an audiometry test. Which of the following instructions should the assistant give the patient? A. Tell me if you can feel the vibrations. B. Close your eyes and tell me what you smell. C. Raise your hand when you hear a sound. D. Read the smallest line of letters you can see. Answer: C. Raise your hand when you hear a sound. This question tests your practical knowledge of patient instructions for common diagnostic tests. The audiometry test is used to measure a patient's hearing ability. The standard instruction for an audiometry test is to have the patient raise your hand when you hear a sound, even if it's very faint, to accurately determine their hearing threshold across different frequencies. The other options describe instructions for tests like vibration sense, olfactory sense, or visual acuity. For example, during the test, various tones are played, and the patient's response to hearing each tone helps plot their audiogram. Clear instructions are vital for obtaining accurate and reliable test results. Question 30. Which nutrient is the body's primary source of energy? A. Proteins. B. Fats. C. Carbohydrates. D. Vitamins. Answer: C. Carbohydrates. This question assesses your basic knowledge of nutrition, a component of patient education. Carbohydrates are the body's primary and most readily available source of energy, as they are broken down into glucose, which cells use for fuel. While proteins are essential for building and repairing tissues and fats provide concentrated energy and absorb vitamins, carbohydrates are prioritized for immediate energy needs. For example, foods like bread, pasta, fruits, and vegetables are rich in carbohydrates that fuel daily activities. Providing patients with accurate nutritional information helps promote their overall health. Question 31. A medical assistant is performing a urinalysis using a reagent strip. Which of the following is a normal finding? A. Protein 2+. B. Glucose present. C. Ketones present. D. pH 6.0. Answer: D. pH 6.0. This question evaluates your knowledge of normal urinalysis findings when using a reagent strip, a common laboratory test performed by CCMAs. A pH of 6.0 is within the normal range for urine, which typically ranges from 4.5 to 8.0, with an average of about 6.0. The presence of significant protein, glucose, or ketones in urine are all abnormal findings that could indicate various health issues like kidney disease, diabetes, or dehydration, respectively. For example, when dipping the strip, a healthy person's urine should show a neutral to slightly acidic pH. Recognizing normal versus abnormal results is crucial for proper patient screening and reporting. Question 32. What is the correct way to identify a patient before any procedure or medication administration? A. Ask, "Are you John Doe?" B. Check the patient's room number. C. Ask the patient to state their full name and date of birth. D. Verify the patient's address with their chart. Answer: C. Ask the patient to state their full name and date of birth. This question assesses a critical patient safety protocol, proper patient identification. To ensure the correct way to identify a patient, you must use at least 2 unique identifiers. Asking the patient to state their full name and date of birth allows you to independently verify this information against their chart or armband, significantly reducing the risk of medical errors. Simply asking, "Are you John Doe?" allows for a simple yes even if the wrong patient, and checking room numbers or addresses alone are not sufficient identifiers. For instance, before giving an injection, always ask the patient their full name and date of birth and compare it to their medical record. Accurate patient identification is a fundamental safety measure in all healthcare settings. Question 33. A medical assistant is taking a patient's oral temperature. The patient just finished drinking a cold beverage. How long should the assistant wait before taking the temperature? A. 5 minutes. B. 15 minutes. C. 30 minutes. D. 60 minutes. Answer: C. 30 minutes. This question tests your practical knowledge of factors that can affect vital sign measurements, specifically oral temperature. If a patient has just consumed a cold beverage, their oral temperature reading will be artificially lowered. To ensure an accurate measurement, the medical assistant should wait approximately 30 minutes to allow the oral cavity temperature to return to normal. Eating, drinking, or smoking too recently can all skew oral temperature readings. For example, if a patient sips water just before you arrive to take their temperature, you should ask them to wait a bit longer. Always inquire about recent activities that might influence vital sign accuracy. Question 34. Which part of the brain is responsible for balance and coordination? A. Cerebrum. B. Cerebellum. C. Brainstem. D. Thalamus. Answer: B. Cerebellum. This question evaluates your basic knowledge of human anatomy, specifically the functions of different parts of the brain. The cerebellum is located at the back of the brain, beneath the cerebrum, and plays a crucial role in regulating motor movements, balance, and coordination. The cerebrum is responsible for higher-level functions, the brainstem for vital life functions, and the thalamus for sensory relay. For example, when you walk in a straight line or catch a ball, your cerebellum is actively coordinating those movements. Understanding these basic anatomical functions helps in comprehending neurological assessments. Question 35. A medical assistant is preparing to clean a wound. Which of the following solutions is commonly used for wound irrigation? A. Hydrogen peroxide. B. Rubbing alcohol. C. Sterile saline. D. Povidone iodine. Answer: C. Sterile saline. This question assesses your knowledge of wound care principles, specifically concerning irrigation solutions. Sterile saline, 0.9% sodium chloride, is the most commonly recommended and safest solution for cleaning and irrigating wounds. It is isotonic, meaning it has a salt concentration similar to the body's fluids, and is gentle on tissues, promoting healing without causing irritation or damage. Hydrogen peroxide and rubbing alcohol can be cytotoxic, harmful to cells, and are not generally recommended for open wounds, and povidone iodine, while an antiseptic, is not typically used for routine irrigation due to potential tissue irritation. For instance, after removing a dressing, you would gently flush the wound with sterile saline to remove debris. Always use solutions that are safe and effective for the delicate tissues of a wound. Question 36. What is the purpose of scheduling a buffer time in the appointment schedule? A. To allow for urgent appointments or catch-up. B. To reduce the number of patients seen per day. C. To provide extended lunch breaks for staff. D. To accommodate patients who arrive late. Answer: A. To allow for urgent appointments or catch-up. This question tests your understanding of efficient appointment scheduling, a key administrative duty. Buffer time is intentionally built into the daily schedule to provide flexibility. Its primary purpose is to accommodate unexpected urgent appointments, handle emergencies, or allow the medical assistant or provider to catch up if previous appointments ran over schedule. It's not about reducing patient volume, extending breaks, or solely for late arrivals. For example, a 15-minute buffer slot might be placed mid-morning and mid-afternoon to manage unforeseen patient needs without completely disrupting the schedule. Strategic use of buffer time helps maintain clinic flow and patient satisfaction. Question 37. Which of the following is considered a subjective finding? A. Blood pressure reading. B. Patient's pain level on a scale of 1 to 10. C. Visible rash. D. Body temperature. Answer: B. Patient's pain level on a scale of 1 to 10. This question assesses your understanding of subjective versus objective data, a fundamental concept in patient assessment and documentation. A subjective finding is information reported by the patient that cannot be directly observed or measured by others, but is experienced by the individual. A patient's self-reported pain level on a scale of 1 to 10 is a classic example of subjective data because it's their personal perception. Blood pressure, visible rashes, and body temperature are all objective findings that can be measured or observed. For example, when a patient says, "My head hurts badly," that's subjective, and asking them to rate the pain helps quantify their subjective experience. Always document subjective complaints clearly and accurately. Question 38. A medical assistant is performing a Holter monitor application. How long is the monitor typically worn? A. 1 hour. B. 4 hours. C. 24 to 48 hours. D. 1 week. Answer: C. 24 to 48 hours. This question tests your knowledge of specific diagnostic procedures, particularly the duration of cardiac monitoring. A Holter monitor is a portable device that continuously records the heart's electrical activity over an extended period. It is typically worn for 24 to 48 hours, sometimes longer, but 24 to 48 is most common, to capture intermittent arrhythmias or symptoms that might not be present during a standard, short-duration ECG. Shorter durations would likely miss transient events, and a full week is usually for longer-term event monitors. For example, if a patient experiences occasional palpitations, a Holter monitor can help pinpoint the cause over a day or two. Proper patient education on how to wear and care for the monitor during this period is crucial. Question 39. Which of the following organizations establishes universal precautions and bloodborne pathogen standards? A. World Health Organization, WHO. B. Centers for Disease Control and Prevention, CDC. C. Occupational Safety and Health Administration, OSHA. D. Food and Drug Administration, FDA. Answer: C. Occupational Safety and Health Administration, OSHA. This question assesses your knowledge of key regulatory bodies in healthcare, specifically those related to workplace safety. The Occupational Safety and Health Administration, OSHA, is a U.S. federal agency responsible for setting and enforcing standards for safe and healthful working conditions, including those related to universal precautions and bloodborne pathogens. While the CDC provides guidelines, OSHA is the enforcement agency for workplace safety. For example, OSHA requires healthcare employers to provide personal protective equipment, PPE, and training to protect workers from bloodborne pathogens. Understanding OSHA regulations is vital for maintaining a safe clinical environment. Question 40. A medical assistant is preparing to administer an intradermal injection. What is the appropriate needle angle for this injection? A. 45-degree angle. B. 90-degree angle. C. 10 to 15-degree angle. D. 25-degree angle. Answer: C. 10 to 15-degree angle. This question tests your precise technical knowledge of injection techniques for different routes of administration. For an intradermal injection, where the medication is delivered just beneath the epidermis, the needle must be inserted at a very shallow 10 to 15 degree angle. This shallow angle creates a small wheal or bleb, which is essential for proper absorption and reaction, as seen in a PPD test. A 45-degree angle is for subcutaneous, and a 90-degree angle is for intramuscular injections. For instance, when performing a tuberculosis skin test, you would insert the needle almost parallel to the skin. Correct needle angle ensures the medication is delivered to the intended skin layer. Question 41. What is the proper procedure for weighing an infant? A. Have the parent hold the infant on the scale. B. Weigh the infant with their diaper and clothes on. C. Weigh the infant naked on a pediatric scale. D. Estimate the infant's weight based on age. Answer: C. Weigh the infant naked on a pediatric scale. This question assesses your practical knowledge of pediatric measurements, a specific clinical skill. To obtain an accurate weight for an infant, they should be weighed naked on a pediatric scale, often a specialized pan scale. This ensures that clothing or diapers do not add extra weight, and the dedicated infant scale provides precise measurements. Having a parent hold the infant or estimating weight would lead to inaccurate results. For example, at a well-child visit, you would gently undress the infant and place them on the scale to monitor their growth accurately. Accurate infant weight is crucial for monitoring development and calculating medication dosages. Question 42. Which term describes listening to the sounds within the body, typically with a stethoscope? A. Palpation. B. Percussion. C. Auscultation. D. Mensuration. Answer: C. Auscultation. This question evaluates your understanding of physical examination techniques, a core skill for medical assistants assisting providers. Auscultation is the medical term for listening to internal sounds of the body, usually with a stethoscope, to assess organs like the heart, lungs, and bowel. Palpation is touching to feel, percussion is tapping to elicit sounds or tenderness, and mensuration is measuring. For example, a physician uses auscultation to listen to a patient's breath sounds for signs of pneumonia. Understanding these terms helps in preparing patients and assisting during examinations. Question 43. A medical assistant is documenting in an electronic health record, EHR. Which of the following is a benefit of using an EHR system? A. Increased risk of transcription errors due to handwriting. B. Decreased accessibility to patient information for multiple providers. C. Improved efficiency and coordination of care. D. Higher storage costs for physical paper charts. Answer: C. Improved efficiency and coordination of care. This question assesses your knowledge of the advantages of modern healthcare technology, specifically electronic health records. A key benefit of using an EHR system is the improved efficiency and coordination of care. EHRs allow for quick, secure access to patient information by multiple authorized healthcare providers simultaneously, reducing redundant tests, improving communication, and streamlining administrative tasks, thus enhancing overall patient care. Unlike paper charts, EHRs reduce transcription errors, increase accessibility, and typically lower long-term storage costs. For example, a medical assistant can quickly pull up a patient's allergy list or recent lab results, which helps the doctor make timely decisions. Embracing EHR systems significantly enhances the quality and speed of patient care. Question 44. What is the proper technique for measuring an adult's height? A. Have the patient slouch slightly for comfort. B. Measure with the patient wearing shoes. C. Instruct the patient to stand erect with their head in the Frankfurt plane. D. Measure from the top of the head to the patient's waist. Answer: C. Instruct the patient to stand erect with their head in the Frankfurt plane. This question tests your practical knowledge of accurate anthropometric measurements, specifically height. To obtain the proper technique for measuring an adult's height, the patient should be instructed to stand erect with their head in the Frankfurt plane. This means their head is positioned so that the line from the bottom of the eye socket to the top of the ear canal is horizontal, ensuring a consistent and accurate measurement. Slouching or wearing shoes would lead to an inaccurate reading, and measuring to the waist is incorrect. For instance, when weighing and measuring a patient at their annual physical, you would guide them to stand straight against the wall or measuring device, looking straight ahead. Accuracy in height and weight measurements is essential for calculating BMI and monitoring health changes. Question 45. A patient has a laceration that is bleeding profusely. Which of the following is the first step the medical assistant should take? A. Apply a tourniquet above the wound. B. Elevate the injured limb above the heart. C. Apply direct pressure to the wound with a clean cloth. D. Wash the wound thoroughly with soap and water. Answer: C. Apply direct pressure to the wound with a clean cloth. This question assesses your immediate response to an emergency, specifically controlling severe bleeding. The keyword bleeding profusely indicates an urgent situation where the primary goal is to stop the blood loss. The first step should always be to apply direct pressure to the wound with a clean cloth, or sterile dressing if available, to help the blood clot and reduce bleeding. Elevating the limb can be a secondary measure, and a tourniquet is a last resort for life-threatening, uncontrollable bleeding. Washing the wound would come after bleeding is controlled. For example, if a patient accidentally cuts themselves deeply, immediately grab a gauze pad and press down firmly on the wound. Remember that direct pressure is the most effective initial method for controlling most external bleeding. Question 46. What is the medical term for pain? A. Edema. B. Analgesia. C. Myalgia. D. Algia. Answer: D. Algia. This question evaluates your understanding of basic medical suffixes, which are building blocks of medical terminology. The suffix algia is a common medical term meaning pain. While myalgia specifically means muscle pain, algia itself is the general term for pain, often used as a suffix in various medical conditions. Edema is swelling, and analgesia is the absence of pain or pain relief. For example, in conditions like fibromyalgia, fibro- relates to fibrous tissue, and algia refers to the pain experienced. Understanding common suffixes helps you decipher many medical terms. Question 47. A medical assistant is performing a 12-lead ECG. Which lead is considered the ground electrode? A. Right arm, RA. B. Left arm, LA. C. Left leg, LL. D. Right leg, RL. Answer: D. Right leg, RL. This question tests your specific knowledge of ECG lead placement and function. For a 12-lead ECG, the right leg, RL, electrode serves as the ground electrode. The ground electrode helps to minimize electrical interference and stabilize the ECG tracing, ensuring a clear and accurate recording of the heart's electrical activity. It is not used to record cardiac activity itself, but rather to provide a reference point. The other limb electrodes, RA, LA, LL, are active leads. For example, when applying the electrodes, placing the right leg electrode correctly is just as important as the active leads for a quality tracing. Proper placement of all electrodes, especially the ground, is essential for a diagnostic ECG. Question 48. Which ethical principle refers to the obligation to do good and act in the best interest of the patient? A. Non-maleficence. B. Autonomy. C. Beneficence. D. Justice. Answer: C. Beneficence. This question assesses your understanding of fundamental ethical principles in healthcare, which guide professional conduct. Beneficence is the ethical principle that obligates healthcare providers to act for the patient's benefit, promoting their well-being and doing good. Non-maleficence means to do no harm, autonomy respects the patient's right to make their own decisions, and justice refers to fairness in treatment. For example, recommending a healthy lifestyle change or ensuring a patient receives appropriate treatment aligns with the principle of beneficence. Always strive to act in the best interest of your patients, embodying the principle of beneficence. Question 49. A medical assistant is instructing a patient on how to collect a stool sample for occult blood testing. Which of the following foods should the patient be advised to avoid before the test? A. Chicken. B. Red meat. C. Fish. D. Vegetables. Answer: B. Red meat. This question tests your practical knowledge of patient preparation for specific laboratory tests. For an occult blood testing, guaiac fecal occult blood test, or GFOBT, the patient should be advised to avoid red meat for a few days before and during the collection period. Red meat contains peroxidase, which can cause a false positive result, mimicking the presence of blood in the stool. Other foods like chicken, fish, or most vegetables do not typically interfere with this specific test. For example, before sending a patient home with a stool collection kit, you would clearly explain to them to refrain from eating steak or beef burgers. Providing accurate pre-test instructions is crucial for obtaining reliable diagnostic results. Question 50. Which of the following actions demonstrates effective therapeutic communication with a patient? A. Interrupting the patient to ask a clarifying question. B. Avoiding eye contact to respect personal space. C. Using medical jargon to demonstrate expertise. D. Actively listening and allowing the patient to express their concerns. Answer: D. Actively listening and allowing the patient to express their concerns. This question assesses your understanding of effective therapeutic communication, a vital skill for building rapport and gathering information from patients. Actively listening and allowing the patient to express their concerns is a cornerstone of therapeutic communication. It involves paying full attention, demonstrating empathy, and giving the patient space to share their feelings and information without interruption, which fosters trust and encourages open dialogue. Interrupting, avoiding eye contact, or using complex medical jargon would hinder effective communication. For example, nodding, making eye contact, and summarizing what the patient has said are all parts of active listening. Always prioritize creating an environment where patients feel heard and understood.